In today's Eye on Health segment, we're talking about a nursing shortage that's not only affecting the hospital where I'm at right now, West Penn Hospital, but hospital systems all across the country. And I'm here with Claire Zangerle, who is the Chief Nurse Executive here. Claire, how bad is this nursing shortage?
Well, it's probably the worst nursing shortage we've ever seen. I've been a nurse for 30 years, and it has never been like this before. And we know that this is going to pass, but we also know the crisis is terrible right now, and we're all feeling it. Even before the pandemic, we had a nursing shortage. We were managing it pretty well before then. We still had all of our tactics in place to get more nurses into the workforce and to retain the nurses we had. But when the pandemic hit, everything changed. We saw that a lot of our nurses were choosing to retire earlier than we thought they would retire because we do have an aging nursing workforce, just like we have an aging population. We also saw that people looked at the pandemic and looked at it as an opportunity to leave nursing in direct patient care. And that's honestly where the biggest shortage is any area, any place across the continuum that has direct patient care is where the shortage is.
Yeah. And so what is AHN doing to address the nursing shortage?
So we're doing a lot of things at AHN to address the nursing shortage because not one thing is going to work. We have some immediate things that we're doing. We're recruiting as fast as we can. We're retaining the employees that we do have because that's our biggest concern, is that the employees that we have, the knowledge capital that we have in our current employees, we want to keep them at AHN, and what is it that we need to do to keep them here? We're also looking at the pipeline. We're working with our academic partners. We're hiring graduate nurses. But it takes a while for graduate nurses when they come into our hospitals to go from school to taking care of patients at the bedside. So we have all kinds of things like that that we're looking at to be able to retain the nurses that we have and recruit nurses that are brand new to the profession and nurses that are experienced.
Yeah, and I know I saw some big numbers earlier. By the year 2030, you're going to need a lot of nurses, right?
Right. We're going to need thousands and thousands of nurses by 2030. But even with the pandemic, what has happened is those numbers have kind of turned on their heads as well. Mm-hmm. Because what we're seeing is more people coming into the health systems, coming into our facilities who want care. That's a good thing. People want to take care of themselves. This pandemic has heightened the awareness of our communities to say it's really important to pay attention and take care of ourselves. But we're behind on having enough people to take care of all those people who are asking us to do that. It's supply and demand, and we're right in the middle of it.
And you mentioned that earlier, and it kind of blew my mind. You know, you're seeing people who are relatively healthy getting sick with COVID, right?
Right. Well, what we're seeing is a lot of unvaccinated individuals getting sick, mm-hmm. and a lot of the unvaccinated individuals are healthy. Maybe they're not getting as sick as in the first waves of the pandemic, but still they're sick enough maybe to take up a hospital bed. Mm-hmm. They're sick enough to come to the emergency department. But what we need is more nurses, more physicians, more support staff to meet this demand.
Yeah, and lastly, you know, a lot of people don't know, but it's great to be a nurse, right?
It's great to be a nurse. I mean, I've been one, like I said, for 30 years, and I can't think of another profession where you can use critical thinking skills, use your heart, your head, all at the same time to deliver some great care and have great outcomes and go home feeling really good at the end of the day.
Yeah, well, thank you so much, Claire, for sharing that information and really the real need and the push for nurses.
Thank you.
Yeah, really important.
Absolutely. We can't have a shortage of nurses.
No.
That's for sure.
And remember to keep watching for our Eye on Health series right here on PTL.
And it happens on Wednesdays. It's sponsored by Highmark Blue Cross Blue Shield together with Allegheny Health Network for your health.